Hello, and thank you for joining me for another important COVID-19 discussion. I'm Therese Souder, Executive Vice President and Chief Operating Officer at Tower Health and Interim CEO at Reading Hospital. Since the beginning of the pandemic, our pediatricians have been receiving a lot of questions about COVID-19 and the vaccine impact for children. Joining me today are two special guests to answer your questions. Dr. Bunmi Ojikutu, Chair of the Department of Pediatrics at Reading Hospital, and Dr. Emily Souder, a pediatric infectious disease specialist at St. Christopher's Hospital for Children, are with me today. Thank you both for joining me.
Thank you for having us.
Thank you for having us.
Throughout the course of the ongoing pandemic, a topic of conversation has been how COVID-19 has impacted children, both mentally and physically. Dr. Ojikutu, can you share what you're seeing in your practice and how parents and guardians can help children who may be struggling?
Thank you for that question. Over the past 18 months, we've watched this evolution of first everybody being in a wait and hold pattern, and then a resolution that we're probably in this for a long haul. And then as children started to be more and more either by themselves in a solitary space, having to figure out online schooling. If you make that a teenager, it's usually a closed room with shades pulled in the winter months. You put the effect of isolation, of the blues of the seasonal time, the anxiety children themselves feel from not understanding what's going on, the anxiety they get from us, the adults in their environment, and the loss of their usual coping mechanisms, be that sports, be that arts, be it extracurricular, be it playing with the neighbor, be it some small group activity you had in your church or community. All that started to come together, and we were seeing an increase in mental health diagnosis in children, primarily anxiety, depression, sometimes self-harm, sometimes suicide ideation, and sometimes, unfortunately, suicides. On the physical aspect, the most apparent one was a lack of physical activity, comfort eating, either as a part of to manage your anxiety or your depression, or just boredom, and that combination leading to obesity. And of course, not to undermine challenges that some children will have, which is a shortage of the resources they need. So while some were obese from inactivity, some were obese from only having access to the less nutritious food, and then some experiencing weight loss, either from the depression itself or the anxiety itself, or just not having food to eat. So initially, children will tell you they're fine. And then with these screening tools that we started relying on a lot, especially when we were using telemedicine, we were seeing that their scores on anxiety questions and depressions questions were really high, and quickly became alerted to the fact that the kids are not doing as fine as we thought. So that we saw that in our office. I think that was seen nationwide, and we were trying to exchange ideas with each other on how to get ahead of it as pediatricians. One of the things we learned to do quickly is find ways to help parents accept it. So parents sometimes were shocked by hearing that their child is depressed, whether it's mild, moderate, or severe. They were shocked to hear that their child might have self-harm thoughts. Sometimes they resisted it. Sometimes they were paralyzed by it. Sometimes they're just overwhelmed. And remember, these parents are people too. They are also going through their emotional changes. So all this is happening at a time where sometimes you couldn't get to your pediatrician or get to your counselor if you already knew you had this condition. Other times you thought you'd been spared of this. This is completely new to our household. So we've learned to let parents know that it does not help to deny it. It in fact helps to acknowledge it. We'll take time together to come to grips with it. But if we can teach you to recognize the signs that we're seeing at an earlier stage, we can work together to get help for your children. Earlier intervention always results in better outcome, as opposed to waiting till something is severe or too late. So we get them on board, have them start discussing small steps they could probably take to make changes. Do we need to make goals together? Simple goals for kids. In my household, it was everybody gets a certain amount of steps a day. We extended that to the children. It was fine. You want to stay on that device, you have to be on the treadmill while you're on that device. It was you have to ride around the block, X amount of times on your bicycle. And then for the teenager that needed more motivation, I realized we had to do things together. For my son that was not competitive, sometimes I bribed, sometimes I begged, sometimes I gave grace, but we knew we had to stick to it. For our parents, I really was trying to remind everyone, after they're done in that room, get them out of that room, open the windows, get them outside, find safe ways for them to be in a small group and start learning to interact with one or two people again. As soon as vaccines became available, we were very proactive in promoting vaccinations. And because that allowed them to expand the amount of activities they could get back into. When there was a need, we learned to quickly help them plug into counseling agencies, whether it's learning about cognitive behavioral therapy or giving kids tools they need to recognize how they're doing and take care of that anxiety or manage their emotions in a healthier way. We worked with them and their families with that. And when there's a need, we need to talk about medications or treat and helping families realize that this is not a permanent label you should be afraid of. We'll take care of it however we need to, get the kids through it, and hopefully get back to better circumstances.
Thank you so much, Dr. Ojikutu. You provided some great insights that I know our listeners will appreciate. Dr. Souder, COVID-19's impact on children seems to have evolved over the course of the pandemic. Last year, it was not seen as much of a risk. Is that changing now that the virus has changed?
Thank you. I think that's a great question. So I think a lot of pediatricians were relieved early last year when the pandemic was just starting that children overall seemed to be less affected. If they did get it, tended to have more mild or asymptomatic disease. And, compared with adults, were much less likely to have severe disease. And, soon after, a couple months later, we started to see some what's called multisystem inflammatory syndrome, which was an entirely new disease that is associated with COVID and can be severe in children. It causes heart complications, among other things. And so, even though overall children were pretty much having, less severe disease, there was still children who got sick, severe enough to be in the hospital, in the ICU, and to get this multisystem inflammatory syndrome. And I think, over the last 18 months, there have been thousands of hospitalizations of children. There's been over 4,400 cases of MIS-C. And unfortunately, there's been over 400 deaths in children. And so I think what that still holds true today, even with the Delta variant, in that children are more likely to have more mild or asymptomatic disease. But what we're seeing now, in the news, there's lots of reports of increasing hospitalizations among children. And what it is that this is a very highly transmissible variant, the Delta virus, and therefore there's just more people that are infected. Children are the majority, at least under 12, are unvaccinated, so they remain a population at risk for getting the virus. And when you have more cases overall, you're going to have more hospitalizations and more severe disease, more deaths just by numbers. And right now, we don't have evidence that this is necessarily more severe in children or that it is targeting children more than other age groups. But I think, a lot of it stems from the transmissibility of the virus, more cases in children. I think a lot of places have, fully opened up. We have less restrictions in place, less people wearing masks. So that all just leads to kind of the continued spread of the virus, more cases, including amongst children. Especially as schools open, this, is worrisome that we're going to have even more cases if we don't have a lot of these really important protective measures in place, such as masking in schools and distancing, among other things. And so I think, just to kind of sum up that in general, I think children are still low risk, but as we see more cases, there will be more children who are hospitalized.
Thank you, Dr. Souder. As vaccinations continue across the country and vaccine trials are currently underway for children under the age of 12, what advice do you have for parents regarding getting their children vaccinated? And Dr. Souder, I'll start with you, and then we'll ask Dr. Ojikutu also to respond to this.
Okay. So I think it's really important that once these vaccines are approved for children under the age of 12, that parents get their children vaccinated. So even though I just mentioned that, the likelihood of a child getting very sick is low, there are still many ways that children are impacted by the virus. So miss school, parents missing work because they have to stay home with their sick child. And there are children who are at higher risk that, will continue to be at risk for severe disease and being hospitalized. We also don't know the long-term effects of COVID-19 on children yet. And so, there are some information looking at long COVID and that this may be less common in children, but it still may happen. And so another reason to vaccinate, because, we're still learning about all the things that can happen after an infection with COVID. New variants are going to continue to emerge, and we don't know what that will bring. It may bring more severe disease. And so I think, trying to mitigate that and vaccinate children once that's available is going to be really important in trying to protect them against these newer variants. Children also make up a good proportion of our population. And as long as this virus continues to be around, to reach a really high threshold of herd immunity in the population, children will have to be part of that. And this is not a new concept. We have many other vaccines that we mandate in children that for them to go to school, just, to protect them and those around them against infection. We know that children can transmit the virus, and so it, not only protects them, but those around them. There may be people in their household that are immunocompromised, are pregnant, and so it's important that even children are part of that because of those things.
Thank you. Thank you for those insights. Dr. Ojikutu, I'll ask you to also comment on your personal experiences around this.
I say vaccinate, vaccinate, vaccinate. If you have a child that is able to be vaccinated, please do so for all the reasons that have been articulated. And I'll share our personal experience. We have a 12-year-old and a 14-year-old, and they were vaccinated the first opportunity on the first day that Tower Health had an opportunity for them to be vaccinated. So we had, of course, done some work ahead of time. We live together, so they've seen the rigor with which we their parents have been following, the safety, the infection rates, the vaccine trials. They've seen their parents themselves get vaccinated, and we listened to their prayers for us. They thanked God when we were vaccinated. They were praying for an opportunity for more people to be vaccinated. We have an international family, so they could see the impact of COVID abroad. They could see the impact of COVID here in the U.S., where there was an opportunity for vaccines. So, their prayers were different. We asked them, what are your hopes and goals? What is next? What can we do differently? They wanted to see their friends and play, and they definitely wanted to get back to school. They wanted any chance that they could to be a part of the whole community getting better. So they trusted my husband and I as we shared what we knew about the safety profiles of the vaccines. In fact, they had been a part of efforts, including Tower's efforts to vaccinate the community as soon as vaccines became available. They really were looking forward to the protections the vaccine offered. Now, our 12-year-old son is the more anxious one. He wanted to know all the symptoms he could have once he had the vaccine, and we went over that. His first vaccination, he was fine. His second shot, he had a bit of a headache for about a day, and I gave him Motrin, and miraculously, I don't think it had even been digested, and he was feeling better. Our daughter was in the middle of a track meet competition, and she's a thrower. So her priority was, I need to not perform poorly because my body aches from the vaccine. But so she got it in the arm she wouldn't be throwing with, and she was fine. She ached, the arm hurt for a day or two, but it wasn't her throwing arm. She was not ill personally, even though she knew she could be, she could have some chills or be sleepy like her mom was. But both kids were fine. They were excited. They were chatty. They told their friends about it. One brought their friend along for the vaccine, and they did well. They recognized that there's a range of symptoms, but both our children did well. So I continue to share that with anyone who wants to hear a personal story, and I hope it makes a difference. But please vaccinate for all the reasons that we have mentioned.
Thank you so much. That's great advice, both of you. And Dr. Ojikutu, thank you so much for sharing your personal history. I think the listeners will appreciate knowing your children were first in line to receive the vaccine. There's been a lot of talk that the COVID-19 vaccines were developed too quickly and they weren't studied enough. Can you share with our listeners the research and the clinical trials that have been completed and are currently underway, particularly for children? I'll ask both of you to comment.
That is a great question. So speaking particularly about mRNA vaccines, which are the majority of the vaccines that are being used in this country, the technology that's used to make them has actually been around for years, almost 2 decades. So it is not new technology. And the reason that we were able to develop these vaccines in more quickly is because they had a lot of backing from the government and just were able to cut through red tape really quickly. But the vaccine developers did not skip any steps in the development of these vaccines. And I think that's really important. They did exactly the same steps that you would do for any vaccine that's already been approved. And making mRNA vaccines in general is just able to be done faster than traditional vaccines. And, I think these numbers kind of are blow my mind sometimes, that there's been in the United States over 350 million doses given, and worldwide, which includes some other vaccines, there's been 4.7 billion doses given. So that's a lot of information. That's a lot of vaccine given. And we have, a lot of safety data from the CDC, who collects data through the VAERS system, and also vSafe. So any of you who've been vaccinated, about the app that they text you a message every few weeks to ask how you're doing, if you're having any side effects. And that's been a really important way to collect kind of safety data after people are getting vaccinated. And from that, we know that these vaccines are extremely safe. And as was mentioned, some of the adverse effects that can occur right after getting the vaccine are relatively mild. I mean, you can have some pain at the injection site. Some people get some mild aches and headache, fever, but those go away within a couple of days. And I think when you compare that to getting COVID, there's much less side effects from the vaccine than from the potential effects of COVID.
Now that we know all the research surrounding the vaccine, can you please explain why it's important for children to receive the vaccine? Dr. Ojikutu, would you like to start us off?
Sure. We know about viruses that their goal is to live. They want to continue to spread. They will adapt, mutate, change, and do whatever they need to continue to live. We also know that they're very simple and they need to infect somebody, use that person's machinery to do that. We call that the whole replication process. So one of the things we know with vaccination, even if your body comes in contact with the virus, your immune system is primed and ready to do battle with the virus. It does a good job of halting this replication process. And if you can do that, if you can disrupt the virus's replication process, you disrupt the virus's ability to mutate. So each person that we successfully get vaccinated, each person that successfully goes ahead and completes their full vaccination is a part of the solution in trying to halt how much dangerous replication and mutation this virus can undergo. That's one. Number two is the personal benefit. These vaccines are shown to decrease the chances of hospitalization and death. So it's one thing to be infected by a virus. We're going to always live with viruses, but let's use everything we've learned up to 2021 to minimize hospitalizations and reduce death. That is everyone's goal. We share that goal.
Thank you. Dr. Souder, is there anything that you'd like to add?
Yeah, I think a lot of parents, I'm sure, have the concern that, well, what are the long-term effects of this vaccine? And I want to wait for more information and more data. But, I think what an important thing to mention is from our other vaccines that are licensed that have been around for years, there's never been an instance where an unexpected long-term safety problem was found only years or decades after the introduction of the vaccine. Most side effects are seen within a few weeks to a month or two after the vaccine. And so at this point, we have many months of information and I think ongoing kind of reassurance that these vaccines are very safe. And they are working extremely well, I think better than anyone expected. And I, want to second kind of what was said about, I think it's, partly our responsibility to care for each other and to kind of protect those around us. It's not just about ourselves. It's about those who are more vulnerable, who can't maybe mount the immune response after the vaccine. That it's, I think as a country, we need to come together and protect each other so that we can get this pandemic under control, because vaccine is really the only way that is going to happen, is for everyone to kind of take part in this shared goal.
Thank you so much. Very well said. As we conclude, what advice would you like to share with parents or guardians about the COVID-19 vaccine?
I would like to let them know that, yes, the right thing for parents to do is to be diligent and is to get appropriate information about any product that you're going to be putting into your child's body. So I would tell them that it matters what the source of the information is, and to please weigh the source in making their decisions. There are very credible websites. The CDC website, the American Academy of Pediatrics, releases information. I like Mayo Clinic's website. John Hopkins website does a few podcasts that just easy to listen to. Please use the benefit of people who've dedicated their lives and are transparent about the work they do in using vaccines to help us individually and as a society. These vaccines are proven safe. There are things to look out for. There are reports of side effects, but that's not a secret. There's a reporting site. We actually have sites set up to ask you what side effects you're asking, because we want to know about it. We want to share, the right people monitor the information and use that information to make adjustments as necessary. So this is all very transparent. It's always been this way. There's no hidden agenda to hurt anyone's child or hurt any individual with this. The goal remains to protect, to preserve life, and to give everyone a chance to continue to live that life of that they want for themselves and their family. So the vaccines are safe. Talk about them, ask us about them, talk to the providers that you have in your life, use your medical home, and that's a language for pediatrics. And please take their advice. If you ask for their advice and they share their advice with you, please weigh that advice well. That's what I would say to parents.
I think we've said a lot of things in terms of why we think these vaccines are important, and that really, talking to your pediatrician or other trusted sources is really important, because there is a lot of misinformation out there that's just not true, and I think it scares people. And so using those trusted resources is really key to trying to get the right information out there. Another thing to think about is that the vaccine, like I said, we have a lot of information on it. It's safe. It works really well. And by not getting the vaccine, there's going to be ongoing risk of getting COVID. And so it's not the vaccine or nothing. It's the vaccine or continue to be at risk for COVID, which has a lot of, worse possible side effects and complications.
I really appreciate both of you being here today to discuss an important topic. Before we close, is there anything else that you would like to add to the discussion?
I just want to thank all the people that are quietly, and maybe not always so quietly, working hard behind the scenes to help get our community well. The people doing the research, the people doing the frontline work, the people keeping our families together, the people caring for those who have gone through loss. We're still going to see, once this calms down, that we're going to realize the breadth of impact once we're out of this shock stage. And somebody's reaching out right now. There are a lot of us. There are a lot of people in the community that are taking care of their neighbors, that are taking the responsibility to help someone who's struggling at this time. So thank you to everyone who's noticing. Even if you didn't feel this way before and you're just starting to change your mind, welcome. You have people on who are willing to embrace you and get you more information and get you more comfortable, and then share your experience with someone, especially if you've come from a place of doubt and hesitation. Someone can relate to that. Someone wants to hear what it took for you to reach the position where you decided to get vaccinated, or you took the step. Please don't underestimate the impact of your personal story or encouraging someone with that. So it's not just healthcare providers, it's not just hospitals and administrators and those of us in this position that have an ability to influence those around us. Every single person, we're in this together. So please share your stories.
I think just, as pediatricians, our top priority is keeping children safe. And, that's why we are all so passionate about the vaccine and getting children vaccinated, because we feel it's very important to their health and safety, and for getting them back to normal life, being able to do activities safely and have that peace of mind. And so, I think it's important to know that that's where we're coming from, that it's all about keeping children safe and healthy. So please get vaccinated.
Dr. Ojikutu and Dr. Souder, I really appreciate you taking the time to share this information today with our listeners. Listeners, thank you for joining us. If you have additional questions about COVID-19 or COVID-19 vaccinations, I encourage you to visit towerhealth.org/COVID-19. Thank you all for being with us. Be well and be vaccinated.